Indonesia is one of the most populous countries in the world, as Indonesia is in the midst of a fundamental economic and demographic transition. The country is projected to become one of the top 10 economies in the world by 2030.
The growing economy contributes to a growing middle class in Indonesia, in which people are more prone to having higher calorie intake and sedentary behavior. Sedentary behavior is defined as any waking behavior, such as sitting or leaning, with an energy expenditure of 1.5 metabolic equivalent tasks or less. Common sedentary behaviors include spending a long time in front of a screen, such as using mobile devices and watching TV, with little to no physical activity involved. This, together with Indonesia's aging population, results in high prevalence of non-communicable diseases such as diabetes. Many of Indonesia's population are at risk of diabetes due to low awareness of diabetes symptoms, resulting in improper or late diagnosis, which may be caused by Indonesia's lack of comprehensive diabetes education programs. Only 47% of diabetes patients are diagnosed in Indonesia, compared with 75% in Mexico and 72% in the United States. Diagnosis also tends to happen late in the disease pathway, when many patients have already developed 2 or more complications. According to WHO, diabetes is one of the main causes of death in Indonesia, and about 10.8% of its population are diabetic.
Thank you, Chephanie. Since diabetes is such a prevalent disease in Indonesia, seeking treatment for it is essential to their long-term well-being. Yet, barriers exist in preventing Indonesians from receiving the treatment they need. Given the disconnected travel routes due to Indonesia's topography and scattered medical facilities that are only found in urban areas, Indonesians living in rural areas find traveling to healthcare centers for treatment too costly and inconvenient. Rural areas often lack trained healthcare workers and appropriate facilities, which limit access to diabetes diagnosis and treatment. Currently, the physician-to-population ratio in Indonesia is only 0.38 physicians per 1,000 population in 2020, which is much lower than World Health Organization's recommendation of 1 physician per 1,000 population for adequate primary care intervention. Moreover, many individuals in Indonesia lack awareness about the symptoms and importance of early detection and management of diabetes, leading them to ignore early signs of the disease, resulting in delayed diagnosis and complications. Furthermore, affordability of diabetes medication and supplies can be a significant barrier for patients, especially for those from low-income backgrounds. Indonesians' out-of-pocket expenditure made up 34.76% of total health expenditure in 2019, which is higher than WHO's recommended maximum of 20%. This means that many Indonesians pay with their own money in order to receive adequate healthcare, potentially eroding their income or savings. While telemedicine can be used as a replacement for home visits and medical consultations in some apps, it may be too challenging to use for the elderly who are unfamiliar with technology. Moving on, Simran will now talk about our proposed solutions.
Our solution is the one-stop diabetes healthcare app called Diabacron, aimed to improve accessibility and convenience for diabetes patients. Accessing the app is easy and safe, encrypted by two-factor authentication technologies to reduce the risk of potential data leaks. Since COVID's normalization of work from home, most of the population has shifted towards preferring online services. Hence, Diabacron provides users with the ability to book online doctor appointments. Diabacron provides 2 main consultation methods. Users can pick either an online consultation that features a video call or a physical consultation at nearby clinics. Diabacron's built-in tracking and monitoring system allows professionals to assess past medical records and data collected from their wearables through its Sync Up feature. The Sync Up feature allows existing diabetes aid devices, such as blood glucose monitors, to be synced to one phone device to improve quality of life. In the case that users need to purchase medical wearables or medication, they can use the in-app shop. This ensures that users in more healthcare-barren areas also have access to these resources. I will now be handing over my time to Mridini, who will talk about the machine learning model for this app. Thank you.
Thank you, Simran. We are implementing an additional feature free of cost in our app to promote awareness on factors playing a role in leading to type 2 diabetes. This will also provide users with an incentive to use our app to look after their health. A machine learning-driven risk assessment tool that accurately predicts whether a user is at high risk for type 2 diabetes based on a series of responses to questions related to the user's lifestyle and previous medical diagnosis and tests. This can also serve as a pre-diagnostic test to enable the user to find out if they need to seek medical advice. In a simple quiz, our databases will store several user inputs as binary digits, 1 for an affirmative response or yes, and 0 for negative or no. The ML model uses logistic regression to learn the combinations of ones and zeros in each category that lead to high or low risk of diabetes, then outputs a classification based on the user's responses, like this one here. This model was created using a simple Python algorithm, which was rigorously trained on open-access diabetes datasets found on Kaggle. The training dataset contained over 70,000 entries on patient type 2 diabetes status, including the binary classifications of their general health and lifestyle. This was done to increase the accuracy of which the model predicts a user's risk level based on their responses to the quiz, as it has now learned to classify various health factors into ones that have previously indicated risk of diabetes. Our model predicts with an overall accuracy of 86%. When tested with another similarly sized dataset of the binary health indicators, we found that our model generally outputted a binary 1 for multiple risk indicators and 0 when there were fewer risk indicators, as can be seen upon further inspection of the new dataset that was created using the test output.
Thank you, Mridini. In this section, I'll be discussing the initial investment required to kickstart the project as well as the ongoing operational costs to keep Project Diabacron running smoothly. Starting with the initial investment costs, these are the funds required to launch our project. They cover various aspects such as market research and planning, design and prototyping, development, which is the largest cost, testing and quality assurance, regulatory and legal compliance, infrastructure and maintenance, marketing and launch, training and support, and last but not least, contingency fund. Adding up all these costs, our total initial investment for Diabacron comes to $1 million, covering all essential aspects for a successful launch. Now, transitioning to the annual operational costs. These are the ongoing expenses necessary to maintain the project's functionality and drive its growth. They include infrastructure and cloud services, maintenance and updates, customer support, marketing and user acquisition efforts, as well as administrative and miscellaneous expenses. These costs ensures the sustained operation and expansion of Diabacron over time. Adding up these annual expenses, our total annual operational costs for Diabacron amount to $280,000. In summary, the initial investment of $1 million and annual operational costs of $280,000 are crucial for Diabacron's success. By planning for these expenses, we are well positioned to achieve our goals and thrive in the market. Thank you all for your attention. Now I'd like to hand it over to Riddhima to delve into the revenue aspects and projected 3-year profit and loss statement.
Thank you, Nayana. Our revenue streams include a pay-per-consultation model, in-app purchases, partnerships, sponsorships, and advertising. With each video consultation with the doctor in our app, we will be charging our users $1 per minute. We will also be partnering with Indonesia's government to incorporate our teleconsultation service as a concerted benefit in their health insurance scheme, Jaminan Kesehatan Nasional. Since 95.77% of Indonesian people are using this scheme as of 2023, this will surely incentivize Indonesian diabetic patients to utilize the app, thus increasing the number of app users. Secondly, users can purchase additional premium features in our app for $5 every month in a year. Thirdly, our partnership with pharmacies to deliver appropriate medication for our users after their doctor consultations will also bring about a revenue of $50,000. Limited non-intrusive advertising will bring about $30,000 annually. The revenue projections for each year is as follows. In year 1, the projected number of active users is 10,000, of which 9,580 are insured. We estimate that 2,000 users will make in-app purchases. Hence, considering that app users pay an average of $10 per consult and have consults every 3 months, the estimated year 1 revenue is $400,000 for the insured and non-insured combined. In-app purchases is $120,000. Advertising and partnerships give a total of $80,000 annually. In total, the year 1 revenue is $600,000. Similarly, the total projected revenue for year 2 and 3 is $1,180,000 and $3,080,000 respectively. Next, here's our profit and loss statement for the period of 3 years. To conclude, we believe that this app and the AI-based assessment tool will be crucial in increasing adherence to diabetes treatment in Indonesia, as it tackles the main problem of the lack of access to diabetes care by bringing a self-diagnostic test, consultations, and health advice directly to users' fingertips.